Hello and welcome to Dark Jedi. Today we have Dr. Sandra Carrillo, who's been kind enough to come along today, and yeah, we're going to talk about being a paying patient on medical cannabis, like I currently am. I know I've benefited a lot. So, Sandra, what you shared some research, didn't you, the other day on pain patients, which I know I interacted with and was very interesting. Is there anything more you can add on this for anybody who hasn't seen that?
Yes, thank you for the invitation. I'm very happy to be here. And thank you for spreading knowledge. This is very important that you're doing because education is the key to the destigmatization of the use of cannabinoids. I am professor of the Faculty of Medicine, University of Panama, also professor of the diploma certification of another university in Colombia, also in Mexico. I'm also teaching in Brazil. So education is a big part of my practice, but also I have my clinical practice where I see patients, and I have seen, as you just mentioned, pain is almost the 60% of the amount of patients that I see are consulting for chronic pain. And we have a lot of scientific evidence regarding to the use of cannabinoids in chronic pain. We have evidence talking about non-oncological chronic pain like fibromyalgia, like we have multiple sclerosis, we have neuropathic pain, we have even endometriosis, we have so many types of pain, arthritis, rheumatoid arthritis. So this is very important. And also oncological pain. We have seen studies, important studies where they are describing the patients undergoing to different therapies like chemotherapy, and patients that they need palliative care at the end of their life. The treatment with cannabinoids is very successful. And what I see in my clinical practice is not just the change on the scores of the pain scales that you can relate with the patients that in a scale from 1 to 10, the improvement. You also see the improvement on the scales of quality of life. That for me is one of the most important things the medical cannabis brings to the table or brings to the toolbox of physicians. And since education is something that I do a lot, I always tell doctors it doesn't matter if they believe or don't believe in medical cannabis. I was the other day approached by a physician telling me, oh, I don't believe in medical cannabis. And he said, we're not talking about religion in here. It's not about believing or not. We have scientific evidence backing
Yeah.
up the use of medical cannabis in certain pathologies. So I think that every doctor should know what medical cannabis is, the indications, the endocannabinoid system, and the scientific evidence, because we owe this to our patients. Because I have seen this phenomenon that is very impressive. Now, the patients are coming to our consultations asking for medical cannabis. Usually was the other way, that the doctor tells the patient what to do. Medical cannabis is like it's a revolution, because it's the patient coming asking for that alternative, and we as doctors and physicians need the obligation to be able to give a scientific response to the patients. But yes, medical cannabis for chronic pain is very big, and there is a lot of studies around this, even talking about the sparing opioid effects. We know that in the United States they have a big crisis of opioids, a lot of people dying from overdoses. And studies have revealed that in the states, in the United States, that they approve medical cannabis, the reduction of opioid deaths is incredibly good. It's like a 25-30%. So we should see those numbers, because as
So
doctors,
important.
we want to benefit the patients with these therapies.
Absolutely. I mean, I think that's one of the biggest things for me. I mean, in the last video we did with Steve Turner, we covered the opioid crisis in America, you know, and talking a bit about opioids here, because I know I've cut down my opioids by 60% now. And my mood has lifted. I'm doing lots of things. I'm doing this YouTube channel, which I wasn't doing before. We've got Medical Cannabis UK, which we're currently in the process of setting up. Medical cannabis has had remarkable effect on me. It really has. And what I wasn't expecting, I thought, well, yeah, no, it'll sort my pain out, but I didn't dream it would sort my mood out. And I'd used cannabis prior to getting medical cannabis, which was very anxiety provoking because it's illegal. I don't really want to be illegal. I've got reputation I need to, you know, I've worked hard on. So with it being legal, it's great to be able, I feel I can come on now on YouTube like I'm doing now and talk about it. And I'm very pleased to have you here because we really know your stuff. And I'm sick of doctors saying to me, there's only anecdotal stories, there's no research. They all say that. And it's like, there is research. So what would be your first answer to that be? Where would you direct them on Google or somewhere?
Yes, you know, that's a very important question. I am actually the president of the Colombian Medical Association for Cannabinoid Medicine. And this is a big question that we always have from our colleagues, because as I mentioned before, there is people say, doctors, physicians, oh, I don't believe in medical cannabis. And since I am professor in different universities, this is the main question I get all the time. And my answer is, first of all, it's not about believing. I'm going to show you where is the evidence. And the evidence is supported by randomized controlled trials. We have numerous systematic reviews, meta-analysis. They are the gold standard of the scientific evidence. So we can provide, and this is the way I start with these doctors, that they are still reluctant to prescribe medical cannabis. And when they see the evidence we have, they started getting curious. For me, that's very important, because I don't pretend that after a lecture or a class, they are all go and run to prescribe, but that will open their mind. They will open their eyes that there is just not just anecdotal evidence. As I said, we have randomized controlled trials, and once we show that to scientific communities of doctors, they started having like a shift in their perception. So that's very, I always guide them to the main systematic reviews we have in 2017, a very important review, like a book of more than 20,000 articles done by the American Academy of Engineering and Medicine. And this was a very thorough revision of all the articles, trying to find where is the evidence. And they actually found very solid evidence for the treatment of chronic pain, as we mentioned, oncological and non-oncological, for nausea and vomiting induced by chemotherapy. And after that book was released in 2018, they approved the Epidiolex for the FDA for the treatment of refractory epilepsy. And then there's other documents, a document produced by Health Canada, where they show all the clinical studies and all the applications of medical cannabis, and also the EMA, that is the entity that regulates the Europe in the medications. They also issued a review. So we have very, very important tools right now that I can direct to doctors and physicians when they want to find where the evidence is. And in our association in Colombia, as presidents, and the mission of our association is promote the education based in scientific evidence. I always tell the patients and the doctors and physicians, don't believe everything Dr. Google says, because, you know, people go to Google and they think that whatever it says in there. And as doctors and scientists and physicians, we have two obligations to see the rigorous studies so we can treat our patients based on scientific evidence. We have papers from the British Journal, the JAMA, different very important journals in medicine. They have been publishing for years studies about the use of medical cannabis, and a lot of studies talking about medical cannabis and pain management. So this is very important. And what I say is, I think medical cannabis is redefining the future of medicine, because in my case, my approach towards the patients right now is very different than what it was like 10 years ago. Now I see the patient in a more holistic way. I don't see a symptom. I don't see a pathology. I see like a whole individual. And that means that you take more time seeing the patient in the consultation and doing the follow-up. So I think that's beautiful, because we're going back to the basics, that what the medicine should be.
Absolutely. I mean, I've been really shocked. I mean, how little information's out there, that the doctors at medical school are not being trained up on the endocannabinoid system. And it's like, why isn't this happening? Well, it all goes back to prohibition back in the 40s, doesn't it? You know, I know even trying to register Medical Cannabis UK, we had the issue because they wouldn't allow the word cannabis in the name. I think definitely we'll post those articles that you've just mentioned, and then hopefully any GPs, doctors, I'm sure, can have a look. But it absolutely has to come from them, doesn't it? Because I know I've seen Dr. Leon Barron. I know he was trying to show some research, some really good research to a GP I know, and just not interested at all, just didn't want to know. And I can understand that, because of the stigma that a lot of people, still there is a stigma about it, even though it's medical cannabis for patients. I mean, what do you think of that, Sandra?
Yeah, I actually have seen the efforts that UK MCCS, the Medical Cannabis Clinician Society at the UK, is doing. I actually am a member of the UK MCCS, and I've seen the efforts of Dr. Mike Barnes and Dr. Danny Gordon, which is a dear friend of mine, and also of Dr. Leon Barron. I mean, they are doing a fantastic job trying to promote education, but it's not easy, as you mentioned, because there is still a lot of scientific communities that they don't want to open their eyes, and this is opening the eyes to science. We're not talking about something that is not backed up to evidence, with evidence, but I think it will take time, and I am so happy to see all these initiatives all over the world, because I see how all together we'll just be adding every day, every year, more evidence, more education, and finally we will have a very broad acceptance of these treatments that actually are extremely important for improving quality of life of patients with certain pathologies.
Absolutely. I mean, I think this is the biggest crime for me. I had my script cut against my wishes. I had my dihydrocodone. I was on 240 milligrams a day, up to 240. I could take it when I needed it. I had that completely cut by my new GP, because I became a refugee from my last GP, because he was going to stop everything. Just literally just stop everything, no replacement. So I ended up moving GPs, and the new GP stopped my dihydrocodone. And then, with another diagnosis I had a diagnosis that my cancer is high risk of returning. And because I wasn't right for the experimental immunotherapy drug, that just wouldn't work with me for reasons I won't go into. So for me, medical cannabis, I was like, right, I really need to get signed up to Project 2021. And I'm so glad I did, because it has literally changed my life. I don't want to come across here as being too like, oh, it cures everything. But my goodness, I did not expect. And this is somebody who's taken cannabis before, but having it, I think, in a regimented dose like that, and having a different mind to why I'm using it, It's had amazing result on me. I feel a lot more happier, content. I feel joy as well for the first time in like about 6 years, because opioids, they completely zap you of motivation and emotion.
Yes. Yes, I couldn't agree with you more. And I see this in the clinical practice all the time, how the patients improve, as you say, not just in the pain, also in the quality of sleep, in the mood, in the perspective and the way they see life. Is such an amazing treatment that I think everybody should have access to health. This is about human rights. We need a medication, and it's so sad to see all the countries that they still don't have medical cannabis approved, and it's also very sad. And I talk about my clinical practice to see how the patients are coming, and they come to the first consultation, they start the treatment, they come the month after, very happy, saying, doctor, I'm improving, I am happy, the medication is doing well to me. And then they come the next month, and they're improving and they're very happy. And then the third month they come and I say, you know something, I love it, I'm doing better, but I'm so sad I cannot keep doing it because this is too expensive for me. So it's sad, because I think that the health system should cover these treatments, and it's sad to see these patients improving, have to go back to the medicine that is covered by the insurance company. So I think we have a lot of work to do trying to help or to make the coverage of the health system wider for these patients that they really need these treatments.
Absolutely. I mean, what I think is the real crime here is that paying patients, I know a lot of them, you know, I've been working in health and social care, you know, for the last about 9 years, 8 or 9 years. So I know a lot of pain patients, and what I'm hearing is people are having their opioids cut by quite a lot, and sometimes completely withdrawn off them when they shouldn't be. They're pain patients. But not one of them has said to me, we were told we could get prescribed medical cannabis legally, and, you know, at the rate, I mean, it's still expensive now, £150 for 30 grams, but that's a lot better than it used to be, isn't it?
Yeah. Yeah, it's improving. And I guess that if all the physicians, doctors, healthcare practitioners, patients, they keep showing the benefits, and this is where something like Project 2021 is so important, because you will just be building more evidence around the use of medical cannabis. So that will give the regulators of each country more reasons to try to include it into the health systems.
Yeah, I mean, I'm really proud I'm on Project 2021. You know, I recently moved clinics, but I'm told, my understanding is I'm still on Project 2021. Nobody's told me I'm not. I feel really proud that I'm on that project. And you only get on that project if you're a proper pain patient with, you know, it wasn't easy. I had to be board approved by a number of people. And it did take quite a while, so you don't get it straight away, but oh my goodness, was it worth the wait? Definitely. You know, I'm not saying everything's perfect, you know, there's been some issues with quality, but as far as I'm concerned, I feel much better. It's legal, I can talk about it. I can use it, and in a different way. When it's prescribed, I think that is why I've seen a difference. I mean, it could be the older strains, couldn't it? I don't know. The older strains seem to be more sativa or indica, whereas the newer strains have been crossed so many times, I don't know whether that means anything anymore. I mean, what are your thoughts on that with the older strains?
Yeah, you know that this at this point is very hard to find pure chemovars and pure genetics, because, as you mentioned, most of them, they are hybrids, and they are with the time that they're going from one country to another country, they are not as pure anymore. So we see more in the prescription side, we see more the Chemovar, the percentages and the milligrams of THC, CBD, other cannabinoids and the terpenoids. We don't see that much anymore. If it's a sativa or indica, because it's really hard to tell right now. So as physicians, we look more at the Chemovar, the percentages of the cannabinoids and the terpenoids to direct the treatments to our patients.
Yeah, I learned this new word from you, Chemovar. I've been doing lots of research. I think we met, didn't we, at Hemp and CBD Expo last year. Yeah. It was actually, I think it just finished in March. It was a couple of days right before lockdown.
Yeah, I remember. Yeah, that was my last live conference in Birmingham.
Yes, that's it. That's it. Yeah, it was quite an interesting one, wasn't it? Especially when that generator blew up. So a bit of excitement for the day. I'm not sure whether you were there for that. Yeah, it was amazing. It really, really blew me away, you know, hearing about the difference. I didn't know any of this. I thought I knew a fair bit, but I suddenly became aware that, oh boy, there's loads more to learn. And yeah, with the different Chemovars. I mean, I didn't realize this. So medical cannabis, can you look at it under microscope and test it for THC and CBD? I mean, is that?
Yes, there is actually laboratories that they're doing this testing, and they report, and this is actually the doctors and patients, and more patients, they have to look before they buy the product they're going to use. And also this is also a part of the quality control of in different countries. They use good manufacturing practices, good laboratory practices, and they have different standards that they have to comply with in order to be able to be approved by the government. And in the majority of cases, let's say in Colombia, we have magistral formulations, and these preparations are made in a laboratory that it has to have an approval by the government, where they have good practices of elaboration. But the most important thing is that these products, they need to have the COAs, that is the certificate of analysis. In these certificates, they gave us and they showed us the percentage of each cannabinoid. Even they report the minor cannabinoids, CBN, CBG, even there is small quantities in the COAs, they should report it. They report the terpenoids, and they report also bacteria, fungus, other type of microorganisms they could be present. So in order to pass these standards, there's always a minimum of these particles that are allowed, and they are safe. Also, the most important thing is they test for pesticides, they test for heavy metals. So it is very important, the testing of a product before it's going to be used as a medicine. So important thing for everybody, for doctors and even for patients, every time they buy a product that they're going to use as a medicine, they need to check the COAs, the certificate of analysis, that will provide all the information regarding to that product. Very important.
Yeah, that would be amazing. I know that would be a real change. I'd have a lot of people saying to me, you know, I wish it said how many terpenes you get in it and everything, you know, because we've got, I mean, I suppose a lot of the patients now, you know, not just on Project 2021, I think we've got, what, 7,000 prescribed medical cannabis patients in the UK. There's quite a big community around that, and they're very, very, you know, clued up. They know their stuff. They know what to look for. You know, and they've probably used cannabis that's been, you know, maybe even, you know, more potent. That may well be the case, but I don't think you can match the type of lab work that happens with medical cannabis. And I think that's important, especially for the general public who maybe not too sure about medical cannabis and they've got preconceptions. So what would you say to them?
Well, definitely. First of all, medical cannabis, as the name says, medical, should be prescribed by a doctor and only by a doctor. So first of all, go to your doctor and get the prescription from the doctor, because the doctor will know what products are safe for the patient, and the dosing, that is very important. And even more important will be the follow-up. We know that medical cannabis practice and clinicians is a very personalized medicine. We have to follow up the patient, because the process of dosing and titration could take time. Sometimes it could take even 3 weeks into define that sweet spot of the patient, or the point where the patient achieve the control of symptoms. And the only way to make this is by the close relationship between the doctor and the patient, with the follow-up. In our clinics, what we do is we call our patients every 3 days for the first month, to see how are they feeling, to see if they need to increase the dosing, to see if they're having some side effects, or if it says that they need to change to another chemovar. So follow-up is very important in order to have a successful treatment with the patients.
Yeah, absolutely. I mean, we cover this a bit, patient-led care with Steve. Steve's, great healthcare professional, and we cover some challenging topics, but Steve's not one to shy away. And absolutely, this is what we were saying, shared decision-making is a bit of a buzzword in the UK. And it hasn't really happened, we feel it needs to move to patient-led care, and I remember some doctors look at me when I used to talk about shared decision-making, but it's so important. I mean, because as sovereign adults, we should be able to decide what medicines go into our body, as long as we're told, what the risks are. And what I find incredible is that nobody's really told me about medical cannabis. They've been quick to cut my opioids, but they don't seem interested in hearing what I have to say. And I have to say, it really does feel like I'm treated like a child, that I don't know what's, the best thing for myself, which I find really insulting. So, I mean, that sounds amazing over in Colombia there. It's Colombia, isn't it?
Yes, it's Colombia. Yeah. We have medical cannabis legalized for 5 years. And now, a few years ago, we have the product regulated by the government. So I feel very happy, because our patients now have access to a treatment that is regulated by the government. So we know we can give the patients a product that is safe, and they have better ways to have access and the follow-up to their treatments.
Absolutely. I mean, I think that is absolutely key. To ring every 3 days, I think that's remarkable.
Yes, it's a lot of work. A lot
yeah,
of work. We do it between the doctors and the nurses, but the follow-up is very important. Very important in order to find a successful treatment. Because sometimes when you start slow, the patients expect that everything happens too fast. But sometimes when you start the titration and you start with very high doses, and particularly with THC, the patient can have side effects, and then they get scared and they abandon the treatment, because they didn't do like the proper titration to get the body to accept and use the receptor. So by doing a titration in a moderate way, I think we can find the relief of symptoms without going to very high doses, which is good for the patient and is good for the pockets too, because they spend less money. With medical cannabis, not always more is better. Sometimes less is better. So this is where I said that the art of medicine is there. Just you are with the hand of the patient, guiding the patient, but hearing about what the patient had to say. Oh, I am feeling this, I am feeling that. Usually patients, when they don't feel improvement, they think they're increasing the dosing and double is the solution. Sometimes it's not like that, because as I said, we have our endocannabinoid system, and we have different reactions to medicines.
I mean, absolutely. I mean, I was really interested. I mean, I've tried some different strains now, and I found with the sativa dominant strains that they were too much for me. They lifted me up, which was great, but maybe a bit too up. So, you know, made my anxiety get a bit worse. So, but then I found with the indica, that would, you know, calm me more. The only problem with the indica is it does send you to sleep. That's probably why it's prescribed at night. But I think we get a tolerance, don't we? We get some part of a tolerance. So I've heard about tolerance breaks. I'm wondering whether that's something we should, cover. What was your thoughts on tolerance breaks?
Yeah, well, the tolerance basically is that sometimes the receptors are saturated, but it's so easy like doing like a 1 day free with no treatment, at least that you have like a condition like epilepsy or some pathology that you cannot stop 1 day. But I have seen that by stopping for 24 hours and starting at a low dose, the patient can start having again the results. And even if you don't want to stop, you will just start reducing the dosing, so the receptors will start getting more reactive. So usually you see this more with THC, but there is different methods that you can avoid this to happen.
I mean, if you're on a relatively high dose, will that dose, if you have a tolerance break, how would you go about doing that? What would you suggest for a tolerance break? Is that, I mean, obviously to talk with your doctor, but what would you say to your patients?
Well, usually it's very personalized because you have to see what is the pathology that you're treating and what type of cannabinoids the patient is using. But you can even reducing the dosing, because sometimes, as I mentioned, people think, oh, it's not working for me, so I'm going to keep increasing the doses. In this case, what you do is the opposite. You start reducing the dosing. And as I said, sometimes if you do like a 24 hours of break, again, you will start getting the results at the beginning. And I see even in these cases, the patient starts with a lower dose than the dose that it was the last dose the patient finished. So it is a very personalized way to do it. When you're going to do this type of treatments, it's always very important to be monitored by the doctor. It's very hard to say like a formula for everybody because we all react in a different way. But if somebody feels like they're going into that area that is not working anymore, it will be good to go to the doctor to start implementing these different types of therapies that they can help the patient to recover again that point where medical cannabis improves their symptoms.
Yes, I mean, I think a lot of pain patients watching this are probably going to be a bit. I think there's a lot of myths, isn't there, about medical cannabis, well, about cannabis. You know, I think there'll probably be a lot of people go, oh, that's going to give me schizophrenia, or it's going to make my mental health bad. What would you say to them that may be a bit nervous, not very up to date with what's going on? Well, like most people, I don't think many people really understand it. There's this myth that's gone out that it causes psychosis. What would you say to that?
Very important. And when we do the consultation, when the patient comes to the consultory, we do a very thorough clinical history record. And one of the main things that we ask in that questionnaire for a patient that wants to have medical cannabis is if they have a family history of psychosis or schizophrenia, and also if the patient has some personal history of psychosis and schizophrenia, because particularly the THC is being associated with like being like a trigger of psychosis and schizophrenia. So yes, you need to watch mainly with THC, because au contraire, we find some studies talking about the treatment of schizophrenia with CBD, with cannabidiol. So in our clinical practice, we watch and the populations of risk where they are like red flag for not using medical cannabis. The first ones are patients with a clinical history of psychosis or schizophrenia regarding to the use of THC, because it's particularly the THC. And also we have to monitorize for the patients that have unstable cardiac condition, unstable pulmonary condition, patients during pregnancy, breastfeeding, adolescents. Those are populations that we have to be very, very careful and to assess risk benefit, what would be the right thing to do for them.
Absolutely. I mean, I have a very good friend. I won't say his name here, but I know he's had it as a relative. And I think I had a conversation about medical cannabis. And he was like, "Oh, dumb thing is, my brother, he not brother, I think it was relative, took medical cannabis and went into a psychosis and took his own life." So. And that sobered me up a bit, reminded me that not everybody's experience with cannabis is going to be popular and positive even. And I think those people, we need to win over to the cause, really, because I spoke to him, and even after him telling me that, he was like, "But Dom, if it medical cannabis, I'm 100% behind it." And I think, well, if he can be 100% behind medical cannabis that's properly regulated and given to patients, then anyone can. Medical cannabis, the British public, I believe it's 59%, something like that, support medical cannabis. My understanding is like 39% are against it or something like that. I mean, what would you say to the 39%?
Well, that's very important, because we've been having these reports in different countries. I say that it will be very strong to say that they oppose, because you oppose to something that you really know what it's about. I'm not talking in any particular case, but what I've seen in my experience is the people that oppose or that disagree or that they don't like or that they don't believe. And we're talking again about believing. This is not about believing, no religion involved. It's just medical, scientific evidence. I'll say always to that people just to look first at the scientific evidence. So you will see with your own eyes that there is scientific evidence regarding to certain pathologies. I think the thing is hurting more medical cannabis is the false claims. There is a lot of people claiming that cannabis cures cancer, cures all the disease, cures this and that, is good for everything. And once we say that, we're hurting science, we're hurting the patients, we're hurting the doctors, because it's not true. Medical cannabis is not a cure for everything. And that's why we start and we have these studies, preclinical and clinical randomized controlled trials, where we see that there is evidence that the medical cannabis is a good treatment for certain pathologies, not for all the pathologies. And that's what at the beginning I mentioned, that we have this robust evidence about refractory epilepsy, nausea and vomiting induced by chemotherapy, chronic pain, and multiple sclerosis. So according to that, and if we keep our dialogue talking about where scientific evidence is, we will provide to these people. They are reluctant to believe that there is not observational or just cases of patients talking. This is a scientific based evidence published in the most important journals of medicine. So I tell to that people, just read the articles, just learn about what the endocannabinoid system, that we all have an endocannabinoid system. We cannot deny that we have it. Believe it or not, you have it. It's inside of your body. It's part of your systems, as you have the endocrinological system, as you have musculoskeletal system, is in there. Even you believe, you don't believe, is there. So you better know what it does. And one of the things it does is just provide the balance and the homeostasis to the body. So just knowing about the endocannabinoid system and the scientific evidence, I think that's a good way to start for the people to approach and learn about medical cannabis.
Definitely. I remember when I found out, about the endocannabinoid system, I was like, hang on a minute, what's this about? And I asked Dr. Danny Gordon, I said to her, like, what's going on here? Is this real? I mean, if it's real, why aren't they teaching it in medical school? Because I'm thinking it can't be right. If you're not teaching in medical school, it can't be true. And then it's like, it is true. And I saw a video by Mike Barnes, Professor Mike Barnes. It was a brilliant video explaining it all. I'm just amazed that is not taught to new students. I mean, I know he does some teaching on it, which is great, but why on earth is this not taught in medical schools? I mean, do you have the same in Colombia?
Yeah, this is like a very big campaign or dream. Let's call it a dream. I have the blessing that I am professor of the Faculty of Medicine, University of Panama, and we've been doing academic lectures for students of medicine, of pharmacy. So we are little by little introducing these concepts to students. Even in the association that I am president in Colombia, we have a special area because usually our members are doctors graduated, but now we open an area for students of medicine, of pharmacy, because we wanna put that seed there that I didn't have when I was a student of medicine. Nobody taught me about medical cannabis, but I think things change and we can make things happen. And as I said, Dr. Mike Barnes and Dr. Danny Gordon and Dr. Liam Barron, they have done like an amazing job and efforts to educate doctors and healthcare practitioners. And I think this will be adding up to all the collective knowledge. And I see how them in the UK are spreading their knowledge. Let's say we're sharing when they do conferences, they are speakers for conference for us in Colombia. So I see something beautiful in medical cannabis is this disposition of doctors and people that knows about this in sharing knowledge, because this is what we want. There is not so much of egos involved. We want other doctors to learn. And this is the beautiful thing, because sometimes in other specialties, somebody wants to know the one who knows more, and they don't want to share their secrets or what they know. I see with medical cannabis, all the doctors are in this journey of teaching others. So if we keep doing this, it's like a snowball effect that we will have. For me, more doctors learn better. And I see this for the majority of doctors in the world that are just studying medical cannabis or cannabinoid therapies.
I think they're all brilliant. I know I've followed a lot of the videos or posts they put out. I'm really interested in drug science. If I was a bit younger, well, I probably could still do a career in drug science. Maybe I might, try and study it a bit, because I find it fascinating. My late father was a GP. My mother was a nurse, so I grew up sort of, a medical family. And I know my dad, he would have been fascinated, my dad, with medical cannabis. He was an incredible doctor, but absolutely teaching, it's absolutely crucial. Sometimes I go in and guest lecture at Anglia Ruskin University, or I've been to UCL as well. And part of that is actually me talking about my experience as a patient. This is more from mental health psychology students, and I will cover my story, as they say, but actually put out covering guilt and shame, because they tend to be equal things that run through. So yeah, working with students is really important. I know I do a bit of work with psychology students on shame and guilt. And I know the students often, they'll do a Q&A at the end, and they're really interested to understand, somebody who's actually lived through that. What do you think about patients like myself, pain patients? I haven't talked a bit about this yet, but my mental health as well has improved from medical cannabis. And I often think actually one of the most powerful things you can do is actually put somebody there in front of the students, you know, who's been through it, experienced it, and can tell them exactly what it feels like. What's your thoughts on that?
Very important, because one thing is the science and the evidence and the papers, and the theory is beautiful, but the reality is also very important. And the reality is what the patient bring to this equation. When you give a lecture talking about, let's say, chronic pain, and then you talk about the science, the endocannabinoid system, the receptors, everything is beautiful. But when you bring a patient into the stage to say, I was having these problems, my pain levels were these hard or high, I couldn't sleep, I was depressed, and then after I started getting my treatment with medical cannabis, all these items improved. So this is like the perfect combination, because you're combining the academic lectures, the science, the evidence, with the reality, the application into the real world that is the patient. So I think they're both extremely important, because without the patient, we wouldn't even have human studies, or we wouldn't even have the proof that this works. So extremely important.
Yeah, absolutely. I mean, I think patients, when they actually, you know, impart some of that experience, that's so valuable. I think, you know, you can study for years at medical school and that, but there's nothing that can sort of replace that experience of actually taking a drug and experiencing what that drug's like. And also, we're all so different. Even if the doctor did, there's no way they could possibly know every single patient with different diagnosis, how that affects them. So yeah, I'm very pro of that. And part of the reason we started this channel, Dark Jedi, is really about, because it's about health and healthcare. And I don't really say mental health because it should be as given, really, that it's part of healthcare, you know, mind, body, and spirit. And yeah, we're hoping to make this channel, you know, the go-to place for health and healthcare. And that includes not only things like shared decision-making or patient-led care, but also about changing that culture, that culture when you go to the doctor and you end up with the parent-child relationship rather than the adult to adult. And I suppose, yeah, that's what we're about. And I'm so pleased to have you on, because there's so many questions I've got in my head, and I'm trying to make sure that I ask everything possible. I know the different audiences out there, people who experience medical cannabis will want to know. But then again, we've got pain patients, haven't we, that may not have tried medical cannabis before, maybe a bit scared of it. You know, I know of my mother, she hates the feeling, you know, the stoned feeling. You know, she absolutely hates it, but she loves the effect from, you know, the pain, because she's in a lot of pain. But yeah, I mean, how do you treat patients like my mother, who maybe a bit older, don't really want the THC, but might benefit from that? What would you prescribe them?
Yeah, that's very important, because the population that seeks more for medical cannabis treatments is the elderly, and it's a big majority of the consultation that I see every day. It's very important to manage expectatives from the patients. I always try to be very, very clear and tell to the patient, this is not going to cure your pathology. This is going to help. This is going to improve. And sometimes we have to tell the patient that even though we know that medical cannabis in certain pathologies, you can start dosing, and at the end you can end up removing other medications the patient is taking, but it's not something that happens like the first day. It takes time. Let's say with opioids, it takes time until the patient probably will end up instead of opioids with medical cannabis, but it takes time because you cannot stop opioids, and sometimes there's patients that just medical cannabis is not enough. They need some opioids too. So as I said, this is very personalized, and the doctor will decide when is the time to start reducing the other medications. But usually in the clinical practice, the elderly patients, they're coming with polypharmacy. They're coming that they're taking 3, 4, 5 medications for pain, for sleeping, for anxiety, for the blood pressure, for diabetes. So this is a polypharmacy that, and this is why, again, and I always repeat the same time, it has to be treated by a doctor, because the doctor is the only one who will know the interactions, drug interactions with cannabinoids, because there is medications that people take every day that they can interact with cannabidiol, with THC, and the doctor will know. So in the elderly, that they are afraid, that they are scared, that when the doctor sees that the patient will benefit from this treatment, first of all, will be manage the expectations, tell them what is the probabilities to achieve relief, explaining that there is not a cure. So when you set up this basis with the patient, and also very important, these patients, when they are cannabis naive, you have to start a very, very little doses. And usually I like to start with CBD so the patient get used. And then if the patient needs some THC, you start moving the patient to different Chemovars. But this is very personalized, because it's according to the pathology, the diagnostic, the patient, the type of medication the patient is already taken. And we have to be very careful, because the elders are very sensitive to cannabinoids, particularly to THC. So we have to manage very well the dosing. And as I said, start with very minimum doses and start titrating up little by little. And that's other part that you have to explain to the patient, because sometimes the patients wants, like after the first dose, they need to just improve in whatever the symptom was. You have to explain them.
Yeah. Are you still there,
that it will to achieve the desired effect. So,
you just paused, you froze for a very slight second there. Do you want to repeat that last sentence just to make sure?
Oh yeah, that is very important, the titration, and to explain to the patient that titration takes time, that you cannot start with very high doses at the beginning. And in the elders, they are very sensitive to medical cannabis, particularly to THC. So to avoid side effects or falls or different types of complications, the best way and the safest way is to start with low doses. As they said, start low, go slow. That is the best way to do it. And of course, always monitorized by the doctor.
It's really valuable that that we have a look, make sure we know all these different drugs, and that somebody's reviewing it, somebody who knows what they're doing and can spot things like that and say, well, hang on a minute, this drug is effective, this is playing on this drug, and you need to change that around. So I know I have changed my medications around a lot, and I feel much better about it. I feel, a lot more positive. I've even lost some weight as well, which I didn't think. I mean, I don't want to all be, cannabis is amazing, it's great, it does everything, but it is true. I mean, I've lost 12.7 kilos, and I think I lost a kilo in about 7 days. I couldn't believe it. And it makes me wonder whether the full gastric bypass I had, in 2012, well, would I have needed that if I'd had access to medical cannabis? It's an interesting question to think about. I try not to think about it too much, but I do think, well, maybe if I'd have access to medical cannabis, maybe things would have played out a bit differently.
Yeah, we need to expand the access for patients, I think, all over the world, and hopefully expand the coverage, because if the patients, the average patient, have no access to treatment because it's very expensive, this will end up being medicine for the rich people, and that will be very sad, because the majority of the people in the world is medium class and even poor people. So if we really want this to work and medical cannabis to be perpetuated, we need to make it accessible and affordable for the patients.
I worked with Ryan Homewood. One of the main reasons we set up Medical Cannabis UK was for, you know, to create fair access for all. Because it's a lot of money, and you know, even though it has come down in price, it's still a lot of money. I know he's struggling to afford it. I know on the long term, it's not sustainable. So we need to do something. There's some great access schemes that I know about. I know when I joined Sapphire Clinics, I think it was a £50 for my first visit because of some patient access scheme they have there. I think that's a step forward. But ultimately, we really need to get this on the NHS here in England. And what do you think? I mean, the amount of money that could be saved from all these other drugs that are used, that in Ryan's case, his liver function, you know, has reduced significantly with all the tablets he's on. I mean, what are your thoughts about the NHS, with it being available on the NHS? I mean, what are your thoughts there?
You know what I see? I advise sometimes governments that they are going to, they're working on the projects of law for approving medical cannabis. And in the cases, every time I talk to regulators, this is not particularly with the NHS, not with the UK. I haven't done that with the UK, but with other countries. The first thing I talk to them, because, you know, to governments, of course, it's important the health of the patient, but when you talk about the economy and how much the government will save by giving medical cannabis to a patient versus the polypharmacy that they have to do. So when you talk about the numbers that the money the government will save, trying to move the patients to medical cannabis, or not even moving them, just giving them access, they will save a lot of money that they will be able to reinvest in education, in health. So that's something that it should be considered. And I always encourage the governments to do these studies. How much is that? We were talking earlier about the polypharmacy on the elderly and patients undergoing to chemotherapy or with cancer, the cost of opioids, or all the rest of the treatments the patients have to take when they have cancer, on palliative care and chronic pain. It's incredible the amount of money that the painkillers, anti-inflammatories, benzodiazepines, all these medications, they cost a lot of money. And you put that in, you can see the medical cannabis can help to reduce that polypharmacy. Is not just good for the patient, because the patient will have less side effects, and this should be like the most important thing, but it will be also good for the government because they will be saving some money. So this is like a win-win situation when we see that we're helping the patients to get better with less side effects, and the government will be having more money to invest in other projects. So I think every country should look at this.
Yeah, definitely. I mean, to me, it's an absolute no-brainer. I mean, you get to help patients, you know, reduce their toxicity of the different drugs that they might be taking, you know, and save money as well. So as far as I'm concerned, it's only a matter of time. And I think it's really important to recognize all the people that come before us as well. I mean, I've come into this a bit late, you know, I'm Johnny come lately to the party, but, you know, I'm really passionate about helping the cause, but I always remind myself, people like yourself, other people who've been campaigning for many years, Hannah Deacon, you know, and then you got Billy as well, you know, changed the law, the boy changed the law. I mean, there's been a lot of amazing work done, and it really does feel like, I don't know about you, but it really does feel like we're at a tipping point. It's quite exciting. What are your thoughts on that? Do you think we're at a tipping point? Is that a global tipping point, or is it just the UK or Colombia?
No, I actually know Hannah Deacon too, and I admire her. Incredible. She's a very courageous and smart, and as a mother, I'm a mother too, and I put myself in her situation, and what she's done is incredible and is amazing, because she's looking not just to benefit her own son, she's just benefiting hundreds and thousands of patients. So this is like something so beautiful that she has done, trying to help patients to get access, and she is also part of the UK and CCS. So I have a beautiful feelings for all of them, because I admire them for all the things that they have been doing in the UK, and I think they're doing things right. And I think we are still scratching the surface. There's a lot to do. I think Hannah and Dr. Barnes and Dr. Gordon and Dr. Barron, they are all putting all their efforts and make this happen for the UK, and they have done projects that they haven't been done in other countries. So I consider that what they're doing in the UK is very advanced, and I hope countries in Latin America can do things like that. So I think they're putting their efforts, and the efforts are paying off in the matter that you see more patients getting access to medical cannabis, more doctors learning how to prescribe medical cannabis, and I think this is a matter of time, as you say, and this is like a global, I wouldn't call it revolution, because it's just about peace and health, about bringing quality of life to patients. So this is a beautiful journey, but I think we're still scratching the surface. There's a lot of things to do, but I see every year more lights here and there, and people getting passionate about this, like you, like the doctors at the UK and CCAs, like myself, like many people that I've known and met from Australia, South Africa, Thailand, Latin America, Israel. This is beautiful, because this is like a global movement in pro of health and of patients. So it's a beautiful cause.
It is, absolutely. I know me personally, I've never felt a stronger calling. I've always been involved in the patient world, let's say, as an active person. And I found it interesting because the medical cannabis community of patients, it felt like it was a bit of a different space. And I suppose in some ways it's trying to bring that together with all patients, really, so we're not sort of kept off to the side. You know what I mean? The campaigning, I think, is really important. We've got so many people doing so many incredible things, and they've been at it for a long time, like yourself, and I think it's really important. I know they've been working really, really hard to give patients the right information. I know at Medical Cannabis UK, we're doing that really hard. And I've heard of other groups where they're getting people off illicit drugs, that don't realise that they could be paying maybe a bit less in some cases and be able to get it legally. And I could just see things growing bigger and bigger. I just think it's amazing. We're standing on the shoulders of giants, as I normally say, and it's really important, I think, to remember that, because I think people move on in their journeys, don't they? And you sort of have to refresh the troops. And I know what we're really passionate is really reaching, I suppose, pain patients first, because I think that's where the biggest injustice is where we've got pain patients being reduced down off opioids, yet are not being told that they could be getting medical cannabis privately if they can afford it. I mean, it's a real unfortunate situation that, you have to be able to afford £150 in my case, but you might not need very much. You might need a lot less. So, I mean, what would you say to patients that have got limited income? How could they, I mean, is there any schemes you know of or anything?
Unfortunately, this has to do a lot with the health care system, because there is countries that even the availability of opioids are not for everybody, and I do think from the perspective of saving money, I was mentioning before. The medical cannabis, for example, a month of treatment for a patient in Colombia could be like $60. Let's say the preparation, that is magistral formulation, and could last 1 month according to the doses. I mean, this is it's not like a fixed number. It could be more, could be less, but even that $60-$70 sounds very little. We have to consider that in Colombia the minimum wage salary is like $350. So for a family that makes $350, $60 a month plus all the things they have to pay like for the rest of their things is a lot. So I think affordability is very important, and I think governments are working, and in the industry is working in affordability, and the main thing will be the coverage by the health system to be able to get the patients. And as you say, the majority of the patients or the biggest numbers are with chronic pain. So even with getting treated with medical cannabis, you don't see it at the short term, but you see it a long term, that using medical cannabis will save you money because you will not have the side effects, let's say the opioids produce, they produce constipation, they produce depression, they produce other things that you will have to solve buying other medications. So it's just not buying the opioids, it's just buying what the opioids are doing to you, so you need to control. So at the end, the mathematics are so simple, and we're talking just about money, and it shouldn't be like that. We should say that because medical cannabis brings quality of life to the patient, and there's no money that can pay for the health and for the well-being of a patient.
Definitely not. I mean, my well-being has improved so much, and it's not just me. I know other people, they've lost weight too. That's no coincidence, you know. I'm honestly blown away with it, and it's to the point, Sandra, where sometimes I'm telling people, I'm thinking, I bet they don't believe it. They think I'm making it all up, because there's been so much improvement, and it just seems crazy that government are not funding this for the NHS, and I really hope we move there. I don't know how we're going to get there, whether we're going to get a subsidized system at first. And I think we've just got to get past this stereotype. And I think the biggest fear, I suppose, is if we have it on the NHS and somebody ends up using it recreationally, you know, puts it up on YouTube, then the rest of the public aren't going to be too impressed. So I think it's going to be a step-by-step process as things slowly change, I suppose. What's your thoughts on that?
Yeah, I think we all have a role to play. For me, I'm very dedicated to educations of doctors, healthcare practitioners, and to the clinical practice, because that's a way to help patients, and also through the clinical practice we are building more evidence, which is very important too for the future.
Definitely. And I suppose as we draw to the end, is there anything else you'd like to add? Anything we may not have touched on?
Well, we could be talking for hours and hours. I am very happy to be here. I think we have to keep joining efforts into educate, not just doctors and healthcare practitioners. We have to educate patients too, because medical cannabis is here and is going to stay, because I cannot see a better treatment for the certain pathologies, as I mentioned. It's not a treatment for everything, but it has clear indications where I see the patients benefit incredibly. So it's very important, and this is like a call for the doctors and scientific communities, that we had our Hippocratic oath, that is to help our patients, and first do not harm. And we know medical cannabis is safe if it's treated and prescribed by a doctor and monitored by a doctor. We can help a lot of patients with this medicine, being responsible, of course, and being empathic, because we know that for me as a doctor, my reason to be is my patients, is to help others. So that is my main motivation.
Brilliant. What better note to end on? Dr. Sandra Carrillo, thank you for being on Dark Jedi, and thank you everybody for watching.
Thank you, Dominic. Thank you.
So I did the clapperboard a bit too soon there.